got me on track to my college career after I got help. Now, I'll go on with after that. I've had a hip surgery, a broken leg, among other injuries. Back in 2013, the VA was prescribing me hydrocodone 10. I didn't really abuse the painkillers, and that's probably why I didn't get hooked. But they were still prescribing them, and as soon as this epidemic started, the VA just stopped giving everybody pills. I wasn't the only one. I've seen the effects of addiction firsthand. One day, the VA just stopped prescribing pain medication completely because of this epidemic, which we were facing today. I have a good friend, and he is a Marine veteran. He served, and I think he got shot in the foot, so he's missing half a foot, and he goes through pain in his foot every single day. And when the VA stopped prescribing the medication, he started buying it wherever he could. And he started drinking a fifth of whiskey a day, mixing the medications, and I was there for him. His wife had died from addiction, I believe, and he was left with two young teenage boys to raise on his own. But being an addict, and him drinking a fifth of whiskey a day, and buying pills off the street, you know, he needed help, but I didn't know it was that bad at first. So I was helping him with his bills and his food, because his wife had just passed. And being around, I started seeing and asking questions, and you know, he ended up telling me what he was doing with his money. So then I tried to get him help, and he hated me. He hated my guts. and after multiple attempts, hospital visits, and ambulance trips, his kids crying because they were watching their father fall victim to addiction. That's when he decided to go get treatment. I finally got him talked into it. That was a tipping point for me. Luckily, I was able to manage and not look somewhere else for this want or need for medicating my pain. It is a hard road that I cannot deny. However, there is light at the end of the tunnel with the love and dedication of your friends and family. As long as somebody's there for you, you don't need anything else. They're there. Don't look past them. I still live with my pain today. And I don't take any medications. I just am in pain. It's okay. You're stronger than that, and you can beat this. Just ask anyone, please. When someone, friend or family member, reaches out and wants to help, please accept them and at least try to overcome this. I will come to the conclusion by saying that your life ahead is and can be a great one. You are worthy.
Thank you, Jason. We will now hear from our last student speaker. Tracy Skaggs is the Vice President of Scholarship for the Alpha Tau Sigma chapter of Phi Theta Kappa. She is a graduate of New Albany High School. She's a human services student here on this campus and expects to graduate in December of 18. She will then transfer to Indiana University Southeast. Tracy.
Again, I want to thank you all for coming and sharing your passion and awareness with me today. So hello, my name is Tracy Skaggs, and I'm a human services student here at the Ivy Tech Sellersburg campus, majoring in addiction, the addiction program, with a special, well, like I said, a special focus on addiction. With the help of my Phi Theta Kappa officers and advisors, I have organized this rally today in order to raise awareness about the current opioid epidemic share with you how I have personally been affected by drug addiction, and celebrate individuals in recovery while showing the community that drug addicts do recover. The rise in heroin and opiate abuse has been devastating our country, with a skyrocketing number of overdose deaths, infants being born with neonatal abstinence syndrome, families involved with child welfare social services, and a rise in the criminal justice and healthcare systems. This public health crisis began in 2014 with a record set high of prescription painkiller overdoses, estimating approximately 120 people dying nationally every day. This opioid crisis has raised much discussion and billions of dollars in governmental funding going towards ways to prevent, treat, and recover from this prescribed death sentence. Regardless of the countless hours of research, theories, and conclusions based around the causes, withdrawal state, ways to achieve recovery, and prevention, no one can explain the reasoning or hell that one endures while living with this disease, except for the addicts themselves. I should know. When you look at me, you may see a college student, a wife, a mother, and a grandmother, but that's not all that I am. I'm a survivor with a dark past, but my past no longer defines me. You see, I'm 46 years old, and I have actually been a drug addict for 42 of those years. At the age of 4, my mother and her friends thought it was cute to have a sweet little girl pass the joint around to everyone. From there, I was taught how to roll a joint, and from there, it went from me hitting the joint at each and every pass that I made. At the age of 13, my mother stuck the straw at my nose, and on the other end was a big old line of cocaine, a shot of whiskey to chase it down, and school the next morning. You see, my mother led me through a life of drugs, alcohol, sex, and even prostitution, although never me. Through her choices, my life was literally put in jeopardy. I have stared at the face of death through many of her drunken escapades. I have had my share of struggles with every drug as an adult, from cocaine to crank, followed by meth, crack, and so on. I would drop each one before I would pick up the next, but I would never return to the one before. Then pain pills came into play. Well, now, I liked those. They were my perfect drug because I could control how high I got. The biggest perk was the fact that I could go to sleep on those. The other drugs, that's a little too high for me. Anyways, I struggled off and on with pain pills and other various drugs from time to time. In 2004, I had finally lost my ever-loving mind and all of myself. To top it off, all of those beautiful childhood memories that I had repressed, well, let me just say, they were fully alive again. I wasn't just a ticking time bomb. I had exploded on all of those who had deceived me. In 2005, I put myself into psychotherapy, and I worked through with a fierce determination. Approximately 5 years ago, I finished my time in therapy, but I was still struggling with an eternal unhappiness. In 2014, as I said, pain pills had become very hard to find on the streets. Now remember, I've done a lot of drugs before, and I've always had some sort of self-respect and limitations, which was heroin and IV use. Well, let me just say, still no IV use, but guess who come knocking on my door? That's right, heroin. Now, I've walked through some fiery pits of hell before, but I had never known fear. But now, for the first time in my life, I was terrified. This drug controlled me. So 4 years ago, I began crying out to God. I prayed at every drug deal that I made and each and every line that went up my nose. I knew that there was nothing as a lowly human that I could do for myself. Well, 3.5 years ago, on March 10th, 2015, God reached down into the deepest, darkest, fiery pit of hell and delivered me from drug addiction. But my struggles with heroin were far from over. For 1.5 years, I had painfully watched my husband continue to suffer from this deadly drug. And then on March 21st, 2016, my worst nightmare happened. My husband had overdosed. Once I'd gotten into the hospital, he was injected with Narcan. The next thing that I knew, I heard code blue. And again, all I could do was drop to my knees and pray. I thank God today that my husband is still alive, but this drug still continued to control him. Finally, he enrolled in a local methadone clinic, and even though it helped to satisfy his withdrawal effect, It did nothing to stop his body from craving this drug, and he relapsed. There was nothing within my power that I could do to give him the help that he needed nor so deserved. So once again, I hit my knees in prayer, and then I enrolled myself into college. On February the 8th, 2017, God finally delivered my husband from heroin addiction. And although my personal struggles with heroin may be over, this war is not. Current reports from the CDC shows an astonishing number of 72,000 people who died of an overdose death just last year alone. And Indiana has now been ranked 34th in drug overdose deaths, with 17.9 deaths per 100,000 people statewide. In addition to this drastic number of Hoosiers dying of an overdose, there is also a 60 to 80% chance that an infant is being born and suffering from neonatal abstinence syndrome, with a total cost of $64.1 million to the state of Indiana for the hospitalization of these infants. Heroin and opiate abuse has taken a tremendous toll on Indiana, with a direct economic cost of $1.4 billion. Which is why Governor Holcomb made a declaration to make the opioid epidemic a #1 priority, which is why our state has teamed up with Indiana University to implement the IU Grand Challenge in response to the addiction crisis. In just a moment, the Executive Director for Drug Prevention, Treatment, and Enforcement, Jim McClelland, will update us on the current preliminary findings from their research over the last several years and what measures they are taking to help tackle this ongoing social problem. But first, I would like to conclude by saying, I have been standing on the front lines of this epidemic from the very beginning, watching my friends and loved ones suffer and die from their addictions. All the research has opened everyone's eyes to the devastation that is ripping across the families in Indiana. But where you see numbers, I see faces. And now, one of those faces is my children. I don't have time for everyone to continue idly sitting by and debating on the best treatment methodology while children's lives are on the line. It is time to take active steps toward affordable and effective treatment for all. Throughout my whole life, I have suffered the pain of being a child of an addict, the consequences of being an addict, the trauma of loving an addict, and now I'm a mother of an addict. A family who was supposed to love and nurture me as a child, and a system that swore to serve and protect for the greater good of the community has failed me my whole life. So today, I stand here with my voice a little louder, saying, I won't fail my children anymore, and I'm begging you not to fail me again. Thank you.
Thank you, Tracy. I'd like to take a few minutes to make some introductions. I again want to thank our exhibit table representatives for being here. You really helped make our event a success, and we really appreciate you being here. I'd like to recognize the Alpha Tau Sigma chapter of Phi Theta Kappa members and advisors. Would you please stand? Thank you. They worked really hard on this event, and Tracy told you she is the brain of this event. She spent many hours with the help of her chapter. So good job, Tracy. We have special guests with us today that we're so happy to have. If you would please stand. Ed Clear is here. He is the Indiana State Representative. Peggy Welch is the Indiana FSSA Chief Advocating Officer. Jim McClelland is the Indiana Director for Drug Prevention, Treatment, and Enforcement. Our campus's Chancellor, Dr. Travis Hare, and our college president, Sue Elsperman. We will now hear from Jim McClelland.
Thanks so much. I appreciate the opportunity to be here. I had the privilege of hearing Tracy tell her story last year. What was it, July maybe, or sometime? I don't know. June last year, and when she asked me if I would come down here today, and I checked my calendar, and it was free. I would love to do that. So thank you for inviting me. But I have to say, first of all, to Aisha and Aaron and Jason and Tracy, you know, there are a lot of definitions of success and formulas for achieving it, but I think the one that is most fitting for our purposes here today is the way that George Patton and Booker T. Washington, two people as different from each other as I can possibly imagine, the way they viewed success, I think is the best fit. Patton was a famous American general in World War II, and there was a movie about him a few years ago, but he said, "I don't measure a person's success by how high they climb, but by how high they bounce after they hit bottom." And in Washington, who was born into slavery, and in the late 19th and early 20th centuries was the leading voice in this country for former slaves and their descendants, said, "Success is to be measured not so much by the position that one has reached in life as by the obstacles he or she has overcome." And friends, I think that we have just heard from some people who have bounced back and overcome some tremendous obstacles. And I certainly want, and I know that all of us wish them much continued success in the years ahead. Now, from the outset of his administration, Governor Holcomb has made attacking this opioid crisis one of his top priorities. And my role is to lead a strategic approach to the challenge, to help ensure that all the various state agencies that touch this issue in one way or another are working in concert with each other, that we're coordinated, that we're aligned, we're focused, we're not duplicating, and as much as is humanly possible, we're doing all we can to make sure that we use the resources that the state has available to it to get the greatest impact. And in addition to that, to try to see how we can leverage those resources that the state has access to with those of other sectors, business, higher education, healthcare, philanthropies, faith-based organizations, community-based organizations. Try to bring it all together in ways that are going to enable us to have the greatest lasting impact. Our two primary goals are, number one, to help those who have a substance use disorder recover and become or return to being productive, contributing members of their communities. And number two, to take steps to substantially reduce the likelihood that we will ever again face a crisis of this magnitude arising from the use of any addictive substance. Now, last year, we put together a strategic approach that had three overarching priorities. We wanted to do everything that we possibly could just to try to help keep people alive. Secondly, we wanted to do as much as possible to expand timely access to treatment. And third, we wanted to take steps to help prevent others from developing substance use disorders. And we've actually done quite a lot in the last year and a half. I'm going to mention a few items, but Kevin Moore is going to follow me up here, and he's going to provide some additional detail and more information about some of what we have done, and perhaps as importantly, what we're going to be doing during the next year or two. But I am pleased to report that we're seeing some very encouraging signs. Preliminary reports indicate that deaths from overdoses are down this year in a growing number of counties, including Clark. Increased use of naloxone or Narcan has a lot to do with that. As I'm sure you're all aware, we have not had nearly enough timely access to treatment in Indiana, and we've actually done quite a lot to help remedy that. Not enough yet, and I'm sure Kevin's going to touch on this, but there's a lot more to come. Thanks to a waiver that we received earlier this year, Medicaid and HIP dollars can now be used for a full range of services, including short-term residential and recovery support services. On the prevention side, we have taken steps aimed at decreasing opioid prescription rates, which were much, much higher than the national average. That too is happening. But going forward, we're going to be doing a lot more to help prevent substance misuse and abuse by children and youth. We want to see much greater use of those programs that have solid evidence of long-term impact, and there are some out there. Some of these programs that are among the best are programs that help young people manage emotions, cope with challenges, develop resiliency, decrease stress, and increase life skills that just in general help young people succeed in school and in life. And we're also going to substantially increase our efforts to educate the public and to reduce stigma. We know it's a huge barrier to effective harm reduction and treatment efforts. We need more understanding, less judgment, more compassion, and certainly wherever possible, we need to do as much as we can to replace despair with hope. And along with all of that that I've mentioned so far, we're going to significantly increase funding for recovery housing and recovery supports. We're also going to substantially increase funding for peer recovery coaches. We've got a lot of work yet to do, not only to address the current situation, but also to reduce the potential that we're ever going to have to face a crisis such as we have been facing for the last several years. Governor Holcomb has frequently called for an all-hands-on-deck approach to end the opioid epidemic, and it's gratifying that all three branches of Indiana state government are making significant contributions to the effort. Other sectors have stepped up to the plate in some very significant ways. We've already heard a bit about the IU Grand Challenge. The Indiana Chamber of Commerce, through its affiliate, the Wellness Council of Indiana, has launched the Indiana Workforce Recovery Initiative to help employers be able to better respond to the effects of this crisis on them and to help engage people in recovery back in the workforce. And a great example of what one company has done is in Richmond, Belden's factory in Richmond that employs about 450 people. And they have launched on their own initiative and using their own money, they have launched what they're calling the Pathways to Employment program. And the way it works is if you apply for a job with Belden, you fail the initial drug screen, they will offer to connect you with treatment. And then if you enter treatment and you complete the treatment program, in essence, they're going to guarantee you a job. And they're doing this with their own money. It's getting not only a lot of attention in Indiana, but it's getting attention nationally. And it's just an example of what one company can do just at their own initiative. They saw a problem. So it's not only a problem for them, it's a problem for society, it's a problem for all these individuals, and they came up with a creative way to approach it. And then there's A Better Life, Brianna's Hope. Our organization started up in a tiny little town of Red Key, Indiana, by Pastor Randy Davis, and he formed a recovery support group, basically because he had lost a member of his congregation to this epidemic and decided he was going to do something about it. And they have now formed 28 chapters in various communities all over this state. And certainly, everyone here understands how important support is in recovery, and we've got to have a lot more people engaged in these kinds of efforts. So much of what needs to be done, especially in prevention and supporting people who are in recovery, can best be done at a local level, at least in part through the development and the growth of strong, community-based, cross-sector coalitions. And that's happening in a growing number of communities around this state, and one of the best that I know of is right here at Clark County Cares. Been in operation about 3.5 years, having some really significant impact. We need the active involvement of local governments, law enforcement agencies, and the courts. We need businesses, chambers of commerce, educational institutions, and healthcare entities. We need community-based organizations, philanthropies, and faith-based organizations. We need for individuals and organizations across all of the sectors of a community coming together, working together, leveraging their respective skills and other resources to help individuals and families struggling with substance use disorder and the array of other problems that so often go along with it, and to help reduce the potential for others to develop substance use disorders. And to the extent that we do all of that, we are simultaneously going to be building stronger, healthier communities for all of our citizens. So I thank you all for what you're doing. Thank you for putting this together. Thank you for inviting me. And I especially want to thank all of the previous speakers for being willing to share their stories and dramatically demonstrating that recovery is possible. Thank you.
We have a representative from U.S. Senator Joe Donnelly here. Her name is Melanie. I'm sorry, I don't know your last name. Thank you so much for being here, Melanie. We really appreciate you being here. We will now hear from Kevin Moore. Kevin, I'm sorry I didn't recognize you with the dignitaries, but we're so happy you're here. Kevin is the FSSA Director of the Division of Mental Health and Addiction.
This is timely to do this, as this is National Recovery Celebration Month, and we're having events across the state. On Labor Day, we turned the canal in Indianapolis purple in recognition of recovery, and it's great to be at this event. I'd like to thank Ivy Tech and Tracy for putting this together. Jim, thank you for your leadership. It's been a great partnership with Jim and his office and other state agencies as we look to address addictions across the state. Thanks to Peggy for manning our Know the OFACs booth. It's part of our anti-stigma campaign that we're using some of our federal dollars for. So I heard earlier one of the speakers telling her stories, and those are great stories. And they're not just stories, they're your life experiences. So thank you for sharing those. Those are so important for you to tell and for us to hear. That the debate of whether this is a decision or a disease rages. And it has impact on how you look and how you treat this. But it doesn't really matter because you end up at the same point. So the debate about moral failing or just a chronic relapsing disease, we'll continue to have that. And we want to make sure that that debate does not further stigmatize folks. The drug addiction that we see has been ever shifting and is emergent all the time. In the 60s, it was pot and heroin. In the 70s, it was LSD. 80s, we saw cocaine. 90s, it was club drugs. In the 2000s, meth. Now we're at prescription drugs and heroin. Although in many parts of our state, meth and cocaine are on our resurgence. So we're seeing that cycle, not necessarily of just the drug, but of addiction. One thing we do know is that there will never, ever just be one answer to this. It takes many paths to get to addiction, many paths to get to that point. It takes many efforts and many paths to support and give people what they need in recovery. And it's great to see a variety of options displayed here today that can support people in treatment and recovery. As the state and the federal government look to respond to the opiate crisis, that debate happened in Congress 3 or 4 years ago. Lots of bills, lots of debate, and finally in the last 2 or 3 years, significant amount of federal money has flowed to the states to help address that. It came in form of the Cures Grant, and Indiana received last year and this year $10.9 million each year to support expansion of treatment. And then this fall, we anticipate another $17.8 million coming for the state opioid response grant from the federal government. We'll get that this year and then again next year. So lots of opportunity to build infrastructure and access to care for folks across the state. And that's exactly how we've used those dollars. Indiana had difficult access to addiction treatment before the opioid crisis. And when this crisis hit, it was just exacerbated. So we've used these dollars not just to build treatment for opiates, but to build addiction treatment across the state. We have expanded residential beds by 26%. We have now more than 1,000 available residential beds across the state. Someone can call 211 and say, I'm ready, I need a bed, and they can go into a system and tell you where a bed is. If you're in front of a provider, they can log into a system called Open Beds and find an open bed in real time. What used to take, here are phone numbers of a dozen places for you to call. They can log in and find a bed in real time. We've supported the training and the employment of peer supports in many sectors, but significant placement of peers in emergency rooms. So when someone shows up in an emergency room and they've been revived with Narcan, there's a connection to a peer support that can connect them to treatment and recovery. We are expanding school-based prevention with these dollars. We have established mobile addiction teams in 14 rural counties across the state. And we'll be working with emergency responders and law enforcement as they continue to respond. We purchased naloxone. So we've done lots of things with the CURES dollars and plan to do even more with the SOR dollars, the state opioid response dollars, including paying for people to go to recovery residences and to grow recovery residences in Indiana. We have a nice foundation of a network of recovery residences in Indiana. We want to grow more, and we'll be able to use some of these federal dollars to support the development and the implementation and the cost for people to be in recovery residences across the state. We'll be training peer support specialists in the Department of Correction, up to 85 peer support specialists that will be then embedded in their treatment programs and then hired in our parole districts to support people in recovery while they are on parole. We will continue our work with the criminal justice system through funding of access to treatment for people who are felons, both as a diversion to DOC or as they re-enter society after serving their time. So we've got just a wealth of initiatives going on, but we know that as the state, we can do so much. We know most of this work happens in rooms like this, in communities like Sellersburg, with people getting together to talk about what can we do locally? What can we do to have an impact for 40 people, for 100 people in our community? The other work that has gone on gets to the issue of medication-assisted treatment. We've been able to expand opioid treatment programs in Indiana to make sure that people have access to that level of treatment. Not everyone needs that, but it's important to have medication-assisted treatment for folks who can benefit from that and are seeking that. We'll be expanding that even further over the next year. Jim mentioned efforts around workforce. In Indiana, our unemployment rate is very low, and that's a good thing. Employers are having a hard time finding people to work, and if we can help people in recovery get to work, that's a good thing for employers and for folks to support their recovery. So we will be rolling out some employer education and training this fall to help employers model what's happening at Belden and in other parts of the state to help them fulfill their workforce needs. So how do you respond to this crisis locally? First of all, you know what your data is. You know what's the overdose rate at your local hospital? What are the arrest rates going on? What's your data telling you what the issue is? And then through coalitions and other groups, you begin to address those issues. You understand that stigma plays a huge role in keeping people in addiction. It keeps people from seeking care, and it can be deadly. So as part of our federal dollars with our Know the OFACs campaign, we're hoping and working to break down that stigma of addiction. And so people can feel they can get the care that they need in a manner that is non-judgmental and not further stigmatizing. So events like today that celebrate recovery are important, not just in September, but throughout the year. So to those of you in recovery, congratulations. I hope that you can continue to find support and success, and that you will tell your story, because it's important for you and it's important for others to hear that recovery is possible. To those that are supporting people in recovery, thank you for being there. Thank you for not giving up. We heard multiple examples of that today. We hope that you will continue to find strength as you listen and support and help those that you love and are walking side by side with. For those that are in addiction and not yet at recovery, know that there's hope and there's help. Treatment works and recovery is possible. And it's our goal as we work statewide to grow access to care so folks can get timely care that they need in order to achieve recovery and get back to the life that we all deserve. So thank you very much for being here today and for allowing me to come. Thank you.
Dr. Hare, would you like to say a few words? Would you like to introduce your boss?
Nice.
Good transition.
Wow, what do I say to that, right?
You say
I
yes,
owe you
I'd
for
love
that.
to.
I would love to, that's right, I would love to introduce my boss. Today's my birthday, can I say that? I was hoping to sit there quietly, you know, kind of, but I owe you now. That's all right. On a serious note, thank you so much for being here and welcome to the campus. And Tracy, thanks for everything. I walked into a meeting a couple weeks ago and she goes, "Here's what we're going to do." So I can handle that. So, the rain held off and the walk and all that. So thank you so much for everything you've done there. So, and again, thank you for being here. And with that, I will introduce my boss. Sue Elsperman is the president of Ivy Tech. And if you come forward and say a few words.
I've also learned you listen to Tracy. You got this handled, you just do it. I know we may have lost Felicia, but Aaron and to Jason, you all just amazing stories. I've also, as Jim knows, got to meet Tracy 2 years ago, about now, as I came across as a new president visiting the IVYT classes. That's our introductory course, and this came up and we talked about how she got here, and you have been such a gift to the college, to tell your story, see your daughter nodding, yeah, she's a gift, and to help us understand that we have to do something. We all are in this together. You all are not alone. You all are fighting like warriors. We have to do our part, and as Jim and Kevin, Peggy, others know, we're all affected. We all have family, friends, loved ones who are affected. So here at Ivy Tech, I'm going to keep this real short. We did our new strategic plan, and we have a goal. Goal 7 is community. And we say it's putting more community in community college. And we're here. The state has created, as Representative Clear knows, they've created this community college system across Indiana, 19 campuses, almost 50 locations. We're in every one of Indiana's communities. We can be part of this. We are part, and we made one of our strategies is to help communities with their most pressing problems. We're here, and Jim knows I've made this offer. If we can be a place where we have gatherings like this, if we can offer programs like our Human Services Addiction Certificate, we'll do that. In Marion, Indiana, Alex Husky, which a few may know, used to be our commissioner for alcohol, tobacco, and firearms. Yeah, he was the DARE officer before he became chancellor. They are offering a open to the public class on addiction. So it's a 3-credit-hour course, but if you're in the public and you're a parent or you have a loved one in it that's suffering from addiction, you can come take the course for free. Travis, we might consider that. But those are, listen to the yeses. I just committed you, I think. But none of us can do it all. I'm so thankful for this governor and so thankful for what you all are doing. Peggy will know this because we share a history. When I was lieutenant governor in 2013, I did a 92 county tour. And call me naive, but when I went to 92 counties, it was the same top challenge in every community. And it was just which order. And Kevin, you spoke to this. Was it meth, heroin, or prescription drugs. It was just which order. Every county might be a different order, but drugs were the top issue in 2013 across Indiana. And this governor has taken this issue, this General Assembly has taken this issue, this federal government has taken this issue, and together we really can do something about it. And I just want to be clear, and I'm being clear for Travis and for Twyla and for all here, we're all in. Ivy Tech, we have to be. When we're registering our students, it's just not uncommon that that's what someone will tell me, that's why they came back. They now are in recovery themselves, and they wanna pay it forward, just as you're doing, Tracy, just as I know you're going to do, Aaron, and just, Jason, as you're doing with the friends and loved ones you have. So we all are part of this journey together, and together we can really make a difference. And so thank you, Tracy, thank you to the Sellersburg campus for offering this. Thanks for all who've been a part of this and are going to be willing to be at the front of the parade as we try to do this together. And I think my last task is to invite our Faces of Recovery to come up and let's do a picture together, okay? So come on up, and thank you all. All right, Charlie. Yeah, so Tracy's got a plan, I know. Come on.
The representative, I was state rep with Representative.
Jason, move to the right a little bit.
All right, everybody, do we not want to How about get can we get Jim McClelland and Kevin?
Yeah.
And Representative Claire? Come on in. Come on in. It's on your